We have had a number of key representatives in health here at the Delegates Conference, giving you the chance to ask questions. And one of those representatives joins us now, the spokesperson for health from the Greens Party, Cecily Rosol. But now, I know you're new to this particular role, but you were a nurse, is that correct?
Yes, I was a nurse until about 10 years ago. Well, actually, I'm still registered, but I'm not working as a nurse. Yeah.
So what are you're picking up this portfolio, what are you seeing with the health system in Tasmania?
I think this is something that most people are aware of, like the health system in crisis, but rather than it being the crisis being addressed by the government, they're just putting little band-aids on here and there and then trying to make it look like they're doing something to fix things. But actually we need to take a much bigger picture of the health service and look at it from that preventative space of how we can stop people getting sick through each stage, right through to when people go into hospital, their flow through hospital, their discharge, the care that they get afterwards. We need to look across that whole big picture of healthcare in Tasmania if we want to fix things. And so, yes, the health system is in crisis. It needs more funding, but I think there are things that we can do that can make things better.
And what are some of those things? I know that you mentioned in your keynote speech that there's 50 points or so, but what are some of those that you could highlight that haven't been done that could perhaps relieve so many health workers?
Yeah, we looked at across the system all the places where we think a tweak, or more than a tweak, some action would change outcomes for people. So more funding into preventative health. So that means funding things like health programs, a health app, that kind of thing. Then we looked at things at the hospital situation and ambulance as well, getting to the hospital, and said, right, there needs more staffing. If we want more staff, we need to look at recruiting and retaining staff and valuing staff and putting funding into things that help improve their work situation so that they stay in employment. We look at more funding, employing more people, creating more positions, but not just creating, broad nurse positions. Yes, we need more nurses, but can we be specific about where we put the nurses? Yes, we could create more discharge positions so that from the minute someone goes into hospital, from the time they're admitted, we've got someone who's responsible as part of a team for planning their discharge so that all the things are in place that are needed, ready for them to go home so that they can be discharged as soon as they're ready to be, with everything in place, and that can then free up help the system flow more easily. So we've looked at things like that.
So Jackie Petrusma is the new health minister. She was a nurse, my understanding is a long time ago. Do you think that that's going to be a positive thing for this state and someone that you might be able to work with? Or what's your take on that change? Because it's been 5 health ministers in 5 years for the Liberal government.
I'm an optimistic person naturally, so I'm hopeful that having someone who's got insight into health will make a difference. It will be interesting to see what changes, what doesn't change, but I think this is as good an opportunity as any that we've had for a while. Having someone who knows how things work a bit more in that position can make decisions from a more knowledgeable place, and hopefully those decisions will be beneficial.
What do you make of the state budget that was handed down recently and the implications that has and is going to have on our healthcare workers?
The Greens are pretty horrified by the budget that was released earlier this year. It doesn't include enough funding for hospitals. It cuts funding, and that's going to have a very real impact on the ground for staff who are working with less, and also for patients who aren't going to be able to necessarily get the care that they need when they need it because the services aren't funded the way they need to be. We would have liked to see the government prioritising health, putting more money into it, and putting in what's needed. looking at what the needs are across the health system and saying this is the amount of money that's needed for it. And then not putting money into a stadium that we can't afford, choosing health over a stadium, and choosing to increase taxes on big corporations who can afford to pay more tax so that we have more money that way to put into the system too.
How do you think it has changed since you were a nurse and, say, people within the healthcare system now? Do you think it's better or worse or similar?
Yeah, definitely worse. There was always pressure as a nurse, but I'm hearing that there's more pressure now on staff. You know, the vacancies that exist now that weren't necessarily there when I was nursing are much more significant, meaning people have much heavier load on them in their work that they're doing. And I'm hearing from friends who are still working in there that things have deteriorated.
You know, I'm looking forward to our annual health debate, which hopefully you can join us for, the live stream, because it will be a good time to then assess, I guess, with Jackie Petrusma, how things are going there and to bring up some issues that perhaps haven't been resolved. So thank you so much for joining us.
Real pleasure. Thank you.